I'm Dr. Katie Scott, and I'm a clinical neuropsychologist specializing in concussion, particularly sport-related concussion here at OCR. So a concussion is a traumatic brain injury that occurs after an individual sustains impact either to their head or to their body that transmits force to their brain. To sustain a concussion, you don't have to have lost consciousness or blacked out. You do develop essentially symptoms following that impact, things like headache, sometimes dizziness, lightheadedness, sometimes alterations in things like memory during the acute phase after a concussion, as well as some difficulties with things like attention, processing speed. And we can also see some change in mood regulation, so feeling increases maybe in low mood or anxiety. Concussion can result in symptoms that kind of span a variety of different domains and different ways that people kind of feel in terms of their how they're feeling physically, but also things like their thinking skills and mood as well. As a clinical neuropsychologist, my background allows me to have a very holistic kind of view of an individual as they come in to see me after something like a concussion. Meaning that I have really extensive training and experience in being able to talk with patients about how they're feeling, not just from a physical perspective after a concussion, but also how they're managing it with regards to things like their mood and then thinking skills as well, so cognitive functioning. That means that I'm able to take a patient after a concussion and see them as a whole person in sort of the kind of spread and depth of the experience of symptoms that may follow something like an injury like a concussion. When a patient comes in to see me here at OCR for a concussion, my initial role is really to spend a good amount of time talking with the patient about how they're feeling from a physical perspective, but also how they're experiencing symptoms in terms of their mood and thinking skills. And then to also spend a good time to understand kind of what their day-to-day life looks like, what's important to them in terms of school or work, hobbies, recreational activities, things like that. So essentially what we're aiming to get them back to when they're ready and safe to get back to those things following a concussion. I see my role as kind of taking all of that information together, so how someone is feeling after concussion, and then the things that are important to them in day-to-day life, and how do we start to integrate back into those activities. We know that after a concussion, it's really important to be able to get back into kind of normal routine and into activities safely with regard to how somebody recovers after a concussion. Often what that looks like is really sitting with patients who include student athletes or adults who've experienced things like maybe a slip and fall or a car accident, a variety of different kind of injury mechanisms, and being able to really sit with them and say, well, here's the symptoms that you're experiencing, here's what we're needing to get back to, and let's kind of talk through a step-by-step process of how to get back into what your normal life looks like. And to make sure that we're doing that safely, particularly if we're talking about returning to things like contact sports or other recreational activities that have some degree of risk involved for head injury. If you or a loved one has experienced a concussion, I'm available to see patients at our OCR locations in Fort Collins, Loveland, and in Longmont as well.